Welcome. Hello, everybody. Thank you for joining in for our fourth session of Moving Towards Generational Healing. The title of today's session is Resilience and Self-Care, delivered to you by Dr. Irit Felsen. Please note that today's session is the fourth out of 6, and we had a scheduling change. Today's session is number 4. The 5th will be on December 17th, and the 6th will be on December 31st. All sessions can be heard, logged into for recorded sessions, and registered for future sessions at www.mjhs.org/healing. And I turn it over now to Irit. Oh, one more thing, I'm sorry. Please, for those of you that are listening in the chat box, if you have questions throughout the session, please type in your questions. All questions and comments will be addressed at the end of the session. And now for Irit.
Hello, everybody. Thank you for being here. And I apologize for the change in the schedule. I had stepped on a piece of glass and it required surgery. So we had to change the dates, and I'm sorry for the inconvenience that it caused. I hope we can proceed from here. I have to state again that I have no disclosures, so we can move on to our topic today, which is resilience and self-care. And so the question that is, of course, very important in the field of trauma and has been so much raised by the families of Holocaust survivors is, how come some individuals have the capacity to move on so well after tragedy and to really embrace life and be fully engaged and enjoy themselves, while others simply survive and really cannot surmount their grief and their depression and other post-traumatic reactions. And since there has been a very large body of studies that have tried to identify what differentiates the more resilient people from the less resilient people, we have certain things that we can learn from it. And if we want to be able to enhance our own resilience and that of others, we really need to understand what constitutes resilience so we can actually work towards it. So first of all, to mention a very important fact, resilience is not a rare quality. The majority of people, even in the United States, in the general population, are exposed to stressors that would be categorized as traumatic events at some point in their lives. At least 70% of the population, 70% of us most likely, have been exposed to a traumatic event in our lives, and we have, most of these people have shown a remarkable capacity to handle it well. So what do we do when we manage to cope well, and how? So what is resilience is actually a pretty complicated concept, and I think we have to stop for a minute to understand the many meanings of it, because when we say it to ourselves, we may mean one of these different things. So first of all, it can be seen as the capacity to adapt well and to continue to function well in the face of adversity, in the face of trauma, tragedy, and stressful situations. That's one definition offered by the American Psychological Association. Many times we look at resilience as a trait, someone has it, or as a process, the way that we cope with a very difficult situation, or the outcome. One is resilient because the outcome shows that they were able to adapt well during or after a terrible event. Very importantly for me to mention here with regards to the second generation is the following issue, which is that resilience is often looked at as either present or absent. The person is either resilient or not resilient. And that actually is not a good way of looking at it. It's a fallacy. It's much more appropriate to look at resilience as something that lies on a range, and it can be, someone can be resilient to different degrees in different aspects of their lives and at different times in life. And that is important in the context of us second generation, because oftentimes individuals say to me, I am seen by other people as so competent in this and that area, so able, so in charge, and yet in other areas these people feel so dependent, so vulnerable, and it's very confusing to them. So which am I, this strong independent person or this vulnerable person which I feel, or dependent person that I feel myself to be inside? Some of the, again, in continuation of trying to understand the concept, some of the ways to understand resilience is the absence of developing symptoms under stress, or, as we said before, a positive adaptation to stress and trauma during the experience that's traumatic or afterwards, whether one has developed some degree of symptoms or not. And another very important point in resilience is a relatively newer point that has been found to be important by recent studies: the capacity to access resources and to harness assistance and help to sustain one's well-being. And that is particularly important for the second generation, because we are characterized by an overemphasis on self-sufficiency and on a sense of having to do it all by ourselves. So all in all, I think a good way of looking at resilience is what I put down there at the bottom of the slide: the reintegration of self, a conscious, intentional effort to move forward in an insightful, integrated, positive way as a result of a negative experience. So it has this intentional focus on, I need to get better, I need to move forward, I need to integrate it somehow and be able to live well after this thing, this terrible thing happened. And the more recent studies about resilience have really contributed a lot to our understanding of the fact that resilience is not something that people just have inside them, just a characteristic that is intra-individual. It is also something that depends a great deal on what is around the individual, what is available to the individual in terms of family support, social support, the environment around them, and that people will be more resilient depending on the availability of support and resources that are in their environment. It is interesting, by the way, I'm going back to the slide for a minute. It is interesting here to note what does it mean for the survivors generation and their ability to have succeeded in so many ways beyond what one would have expected given their traumatic experiences, even though they had actually very little environmental support and very little was made available to them in terms of the resources and accessing them. So they were immigrants in a country that was just established, Israel, and where there was no awareness to it in the initial years and no resources available. And even in the United States, very little was made available to them, and yet they managed. So what does that mean about their drive to move forward and to reintegrate and decide to make a life? We, as the second generation, obviously have inherited also some of that incredible resilience. So some of the things that we know now help determine one's capacity do have to do with a lot of factors, internal factors and external factors. There are genetic elements to it, of course, like everything else. We are born with certain genes, with certain inherent physical and psychological vulnerabilities and strengths. There are also epigenetic changes that have been shown over the last 15 years in studies. That means that certain things, certain traits can come to be expressed without changing our DNA because of circumstances that our parents were exposed to, because of hunger, because of fear. Certain genes or certain genetic traits become expressed which might have not been expressed otherwise. We have developmental influences throughout our own lives. We have demographic and cultural and economic, all kinds of factors that interact in very complicated ways with one another to determine how people respond and how resilient they are in the face of very stressful life events. And all of them in this complicated interaction have some weight, but there is one factor that stands alone in terms of how much it influences our individual level of resilience, which is how strong and healthy was our attachment relationship while growing up with at least one adult who was functioning well and was protective. And that is something that, given the very good adaptation all in all of the survivors as a group, shows that as a group they had positive attachment relationships with their parents, which is one of the reasons why the transmission of trauma to the second generation has been much less negative than it could have been when we compare transmission of trauma in families in other populations. But that's a point we can expand on later on if it's of interest. So moving on is the main feature of resilience despite adversity. Resilience is not the absence of pain or symptoms. It can be there with pain and with symptoms, much as courage is not the absence of fear, but actually the capacity to act in certain ways despite the fear. And survivors as a group represent a very large group of very diverse people with very different traits, very different sets of skills, all of which decided to and managed to recreate life and function in a world despite their catastrophic history of pain and trauma. And we, the children of those people, have inherited many of these resiliencies. So in this session today, I want to focus on self-resilience and self-compassion, which is something that we have become much more focused on since there has been a paradigm shift in psychology with the sort of emergence of positive psychology with Martin Seligman and his group and other people. Traditionally, mental health was focused on problems and on psychological difficulties, and positive psychology has shifted our attention to what does it mean to have psychological well-being? What does it mean and what makes quality of life and what supports functional, optimal functioning? So the assumption of positive psychology is that we can counter a lot of negative feelings and a lot of negative aspects of people's functioning by actually focusing on the positive, focusing on the positive instead of targeting the symptoms. And focusing on the positive in positive psychology includes a couple of very important elements. One is to identify, utilize, and foster what they term character strengths. We all have certain strengths and we all have weaknesses, and identifying them is very helpful to allow us to be much clearer about it and capitalize on the strengths when we face stressful situations, and understand our vulnerabilities and be able to work better in a more focused way on our weaknesses or vulnerabilities. Of course, doing that takes a lot of time, takes commitment, and it's very important to be patient with oneself as we try to work on and change lifelong patterns. So be patient with yourself. Try to be kind as you would be to someone else you would be trying to teach or educate in something very new and not simple. So in order to clarify what our strengths are, I decided to enumerate a few of the strengths that I have identified in my work with the second generation as very prominent to our psychological profile. And first of all, what I want to say is the strengths and the vulnerabilities in the second generation are very unique in the sense that they cannot be seen as separate strengths here in one category and vulnerabilities over there. For example, when we talk about certain personalities, let's say the person who's very, what we would call schizoid, very good at doing their work, very intellectual, very precise, very deep in their engagement with their work, but has very clear deficits or deficiencies in their social skills. These are very different strengths and very separate vulnerabilities in the psychological makeup of that personality. In contrast, the strengths and the vulnerabilities of the second generation are more appropriately seen as the two sides of the same coin. The same quality can be a strength and a vulnerability depending on the context, on the time, and how it comes to be manifested. So the same trait can be both simultaneously an asset and a liability. And if we know that, then we can work with it a little bit better, I think. So let me mention some of these strengths. So one of them, as a result of the awareness, the great awareness of trauma and what we discussed in previous sessions as the transmission of historical trauma to the second generation, we have a very acute perception of the fragility of life, but with it also a very precious perspective on life, which is consistent with what we call in the literature post-traumatic growth. There are post-traumatic reactions and symptoms, but there is also post-traumatic growth, which is this precious recognition of what is most important to one in life and what one's, a clarity about one's values, and simply a very acute appreciation of the preciousness of life itself. We also have a chronic preparedness for disaster. We are always alert and prepared for all kinds of negative events. We are very, very acutely aware of the possibility of things going wrong and how should they go wrong, and we prepare for it. We can see it ahead of time. It can be a tremendous resource in many, many ways, but it can also be related to a chronically elevated level of anxiety and worry, which can prevent us from being able to relax and enjoy life and just take it easy. It takes away sometimes from the capacity to have that kind of well-being. Some of us have a strong need to be self-denying. We need to be frugal. We need to be conserving of resources, even when it's not really necessary based on our financial situation or other circumstances. And it may look like an irrational behavior or a stinginess by others, but it actually represents a certain sense of identification with our parents, a certain appreciation of the need to be always, again, prepared and able to deal with less, a certain way of proving to ourselves that we can also manage if we have to. There's also a hardening, which was very much part of what was seen in the survivor generations, a capacity to work very hard, to postpone gratification, and to ignore discomfort and difficulty, even physical discomfort, and to express a general sense of well-being in life despite even having various physical ailments or sleep disturbances or being tired or all of those things. This is, of course, a huge asset and strength in many ways, but it can also be a vulnerability because it can also mean that or be the cause of ignoring signs of physical problems when they begin to develop and noticing them only when it's a little too late, when they've become real problems already, which is something that might explain why second generation in middle age have been shown to have more physical problems than their peers who are not Holocaust survivors' children. Resourcefulness is another thing that I think is very common among the second generation. I had a patient who said, I can make a meal from dust. And many of us can too, which is a tremendous ability to make something out of nothing, to persevere, to work very hard and very creatively in order to make things work out even in difficult circumstances, which can be a huge and tremendously useful creative ability, but it can also be, it is especially, especially useful when you're really dealing with circumstances which are unchangeable, things you have no control over. So it's been extremely moving to see how some of my patients who have a child with special needs have been able to deal with that. Other circumstances where we really can't change it, we can only try to make the best of it. And people have done amazingly moving things, but it can also be a liability when you apply the same behavior or the same concepts to relationships that should be terminated actually, such as a very bad work placement, a bad job when you can actually find a better one, even a bad relationship, a bad marriage if it's very bad and you really need to know, or a bad partnership where you need to actually step out and not apply the same pattern that one has had from childhood of having to make it work and it's up to me, and if I only try harder, I'll make it work. Another one is the capacity to mobilize tremendous talents and tremendous assertiveness and tremendous ability in the service of other people's needs. But at the same time, and this is particularly true in my experience, in my clinical experience with women, daughters of survivors, they've been able to do amazing things when they apply their talents and their assertiveness in the service of the institution that they work at, the school, the business that they work at, or in the service of getting what services are needed for their own children, but they're not able to put the same level of direct action and assertiveness in the service of their own needs. And I think that that is clearly related to many of the issues we discussed that are so typical of the second generation, and especially of the daughters of survivors, having to put the parents' needs always first, and feeling somehow that putting our assertiveness in the service of our own needs might come at a great cost to the parents in terms of pain and worry and anxiety, and therefore developing almost a lifelong sort of fear of following our own needs and putting that full horsepower behind our own needs and our own goals. But it's okay to do it for somebody else's needs that we serve or care for. Another thing is a very profound and desperate need to humanize the other. So I think because we are so aware of the inhumanity and the potential aggressor that lives in the other, in every other, we need to reach the humanity in the other very desperately for our own sense of safety in the world. And therefore, I'll give you an example. I had a patient one who was a contractor, and he was struggling to be on a diet, which was very important for his health. He was already quite overweight. And he told me how important it is for him to always be making a kind of a real personal contact with his clients and really understanding what they want and making it a win-win situation for him and for the client. And he thought once that he gave me this example of a client where he really thought they connected well, but then he hadn't heard from him. And when he passed by his house, he could see that the work was being done by someone else. And he couldn't understand. That's what he brought to our next session. He couldn't understand why he had such a terrible reaction to it, so disproportionate. He could see that himself, that it was so disproportionate, and that he stopped on the way at the supermarket and gorged on some food that he shouldn't have eaten, and couldn't understand why it went so deep into him. The fact that he thought he made a connection with the person, and obviously he had not, and the person did not even feel the need to call him and say, I'm sorry, but I'm giving the job to someone else. I think that goes to that sensitivity of ours, and I think it's an asset because we do therefore make the extra connection to connect with people and to reach people as human beings, and we can also become very overreactive when, for some reason, we fail. Empathy is another thing that is, I think, highly characteristic of the second generation. Many of us are trained empathic helpers from the time we were very young, because putting our parents' needs ahead and being sensitive to where the parent who has some post-traumatic symptoms to this extent or that extent, where they are emotionally, and not to add to that, is really, in other words, a training in being very empathic all the time and aware. Many of us have become professionals in one of the helping professions, teachers, mental health professionals, doctors, and so on. And we have a very strong need to make the other person better, feel better, make them better. This is, of course, a potential great strength. It can also come at a great cost to one's self-care, especially I see it now sometimes with second generation who are grandparents and are really torn between the needs of several children, several adult children who have multiple grandchildren and various needs. And if you're used to having this compulsion almost to help all of them, it sometimes can get incredibly daunting and incredibly difficult to respond to all of these needs. Finally, I like to use the analogy of a little magnet next to a big magnet, which I think applies a lot to our psychological internal state. You know, little magnets next to a big magnet sort of reorganize themselves to the bigger magnet. And I think in this way, for us, the needs of the other person immediately and automatically change and shift our own sense of our needs, or make or override our needs. And that, of course, can be an asset and can be a liability. So knowing these things helps us be a little bit more aware of the upside and the downside. And it's all really about a certain capacity to take a step back from being in our automatic reaction, being immersed in it, to looking at it from a certain step away and thinking about it. So, you know, just shortly to mention, all of us, all human beings have a negativity bias, which is something that evolved over the psychological evolution of the species. We need to pay attention a lot more to dangerous things and to negative things than to good things, because it's much more important for our survival. And trauma in the family emphasizes this tendency in the second generation. So that makes us a little bit more sensitive to negative, to the negativity bias, to negative memories, to negative feelings, and the interaction between that sensitivity of ours, which is related to post-traumatic symptoms and to the transmission of trauma in the family, that sensitivity interacts with grief and creates an even greater focus on negative emotions and negative interpretations. So I brought you this picture because I think it is another very powerful visual way of looking at these things. These are very famous pictures in psychology. Look at it and ask yourself, what do you see? Many people will see much more powerfully and clearly the image of a beautiful young lady, and other people will see much more immediately and more powerfully the face of a very old and unattractive lady. And some will be able to move their focus from one image to the other with more effort or less effort. This is really a very good exercise in what it means to shift our attention, because both the young lady and the old lady are equally present in this image. The question is only what makes our brain see one more clearly or more powerfully, more compellingly than the other. And that is really what positive psychology tries to tell us to do, is to learn to shift our cognitive attention, our memories, our expectations from negative and catastrophic towards more positive and more hopeful, from embittering experiences, from self-blaming and guilt, to the capacity to enhance and savor good memories and good experiences. So one of the ways to do that has to do with really shifting our attention to being able to recognize what was the activating event that caused us whatever negative reaction we had, what were our beliefs about it, what were our thoughts about it as soon as it happened, and what were the consequences, our behavioral consequences following those thoughts. So if I think, for example, immediately here, if my explanatory style and thinking trap, as they were called by Seligman and his colleagues, if anything that happens immediately tends to be interpreted by me as, oh, it's my fault, then that's my belief or response to it. And what would be the reaction that caused in me? What would I do if I immediately feel, oh, it's my fault? And so Seligman and his colleagues talk about icebergs in the deep. Icebergs are deeply held beliefs that we have, and they can be positive or negative, about ourselves in the world. And once that kind of a belief is identified, we can much more easily reevaluate it and consider whether it's still appropriate for the current time in our life, or the current context in which we are, because we may have learned it and it has become a very powerful automatic response pattern because it was somehow an appropriate pattern in our childhood or growing up, but it may have become obsolete. It may have become really inappropriate for the relationships and the circumstances that we have right now. So the questions we have to ask ourselves after we identify such an iceberg, such a belief that we hold, for example, that we tend to go immediately and automatically to, oh, what did I do wrong? Or it's my fault. We have to ask ourselves if that pattern is still meaningful to us, if it's still accurate or appropriate for this situation, that response. Is it an overly rigid way of looking at things? Is it useful for us? Does it enhance our functioning and that of those around us? So a suggested exercise for you for later would be to take a moment to think of some recently stressful situation or interpersonal interaction or anything that happened that caused you some distress, and think about what was it, what were your thoughts or beliefs immediately following this situation, what did you tell yourself, what actions followed those thoughts, and what thoughts, actions, beliefs, feelings might be better ones, more appropriate ones for now that you could intentionally try to substitute for the ones that you automatically go to, or for the ones that you automatically went to in that particular situation. So studies have tried to identify for us what does it mean to live a good life. And all in all, the empirical findings show us that the pursuit of meaning and engagement are much more robustly associated with a greater sense of well-being and life satisfaction than were the pursuit of hedonistic pleasures, such as, I just go traveling and I go to good restaurants and I go to good shows. It in fact was even shown to be associated, that is the pursuit of meaning and purpose in life was actually even associated with greater longevity. So some of the correlates that were found in studies to be associated with greater well-being were, as I said, purpose in life, a direction, a sense of meaning, which I think is a very important issue to highlight in connection with the fact that, as I stated before, many children of survivors, and especially daughters, have put a great deal of their time and effort in the service of other people and have had a difficult time typically identifying their own direction and what would be meaningful and purposeful to them if they're not working for other people or serving other people's needs. And that is very important, in particular at this point in life when most of us have completed raising our children and many of us are already retired. Autonomy means living in accordance with one's personal convictions and values, and that is not always easy because many of our values can be sometimes in conflict with one another at different ages. I'm just thinking about an example from yesterday where someone was talking to me about the fact that on one hand her father had abandoned the family of 8 children, and things were very, very difficult growing up. But now she has some relationship with the father, and the father had asked her if he and his new wife can come to stay in her house for a couple of days. And it's very important for her to, maintain kibud av va'em, respect for our elders and our parents. And at the same time, it's very important for her to be self-protective and to show herself that she's not the same kid who's so easily exploited and taken advantage of by this father. So our values can definitely conflict, and living autonomously means that we actually give ourselves the time and the permission to think through these things and make a more coherent whole from these conflicting issues and values. Personal growth is using our talents and our personal potential. We like to use it. It gives us a good feeling. It makes us feel worthy when we actually utilize our skills and our talents. Environmental mastery means managing life situations well, and that's something that the second generation has actually been quite competent at. So I won't spend too much time on that. I will spend more time in the following few minutes on the positive relationships, which is the depth of our connections and the quality of them, and self-acceptance, which is the knowledge and acceptance of ourselves, with the emphasis on the acceptance of ourselves, including our strength and limitations. And those are 2 points that I think, because of the special characteristics of the second generation, as we discussed in previous meetings, these points may have more to do with our vulnerabilities. And it has been shown by very important lifelong longitudinal studies about adult development how important are our positive relationships and self-acceptance to the quality of life, especially in the later part of life. So these are important things for us to talk about. So what we learned from positive psychology and some studies in that area is that we can enhance our capacity to feel happiness or to feel good emotions. We can learn to enrich and extend the duration of good emotions. We can also learn to avoid or prevent our tendency to prematurely curtail positive experiences. So first of all, it's important to notice if we do that, and many of us are not aware of the fact that we do that. It can mean, for example, that when someone gives you a compliment, you sort of almost cut them off while they're saying it, and because you're embarrassed, and you kind of move to the next thing, as opposed to actually allow that person to express it and allow yourself to let the compliment land and really take its place inside and really give you the good feeling that that person is trying to give you. It can also be just allowing yourself to really take the time and give enough space and opportunity for yourself to enjoy the beauty of a tree in the changing colors right now, or the beautiful feeling of the breeze on a beautiful day, autumn day, as today I think is going to be. To really savor it and to really give it its due place, because we tend to take that for granted and sometimes sort of curtail it, but we sure focus on the bad aspects, and that's the negativity bias, on the fact that the train is late, that we had no seat on the train, or whatever those things are. The other 2 points, meaning, I think I mentioned already, an engagement, which has to do with finding ways to use our talents, because increasing our engagement in something that we enjoy doing, increasing that feeling of flow, is very important for our sense of well-being. So how do we do that? A couple of very small practical suggestions from positive psychology include keeping a daily diary of positive experiences. So just positive experiences, and that allows us to elevate, to heighten our attention and focus on the positive. And an exercise would be to think of a moment that you enjoyed something recently. How might you have allowed it to be as intensely positive, as long, as full as it could have been? How could you improve in this area? A very common exercise we do with students in the classroom is we give each student a raisin, and we say, eat the raisin, and then we give them another raisin, and we say, now eat the raisin slowly and really focus on every little sensation that you get while eating the same one raisin, and see how different that experience might be when we actually intentionally focus on it and enhance our sensitivity to every aspect of it. Another very important thing, and very simple, but nonetheless many of us fail at it, is to know how we care for ourselves. Many of us do already take care of ourselves at times when we're feeling well in particular, and we know that we enjoy certain things and that those things make us feel better. But many of us tend to forget that or not do that, especially when we are suffering. So it's really important to be very clear to ourselves and identify what are our preferred methods for feeling revitalized, connected, or for relaxing and for self-soothing. And for some of us, it would be meditation or positive imagery or prayer. For others, or music. For others, it would be controlled breathing, progressive muscle relaxations, all of these yoga, all of these other ways that are in that category. Exercise for many of us is very revitalizing and relaxing and helps people turn off the negative chatter in their brain, especially if they go for very strenuous exercise. For others, it's sensuality, massages, intimacy, sex. For others, it's sleep, laughter, going to see a show that takes your mind off of your own inner chatter, as I said. It's very important to know which one of these is actually, or which of those few are useful for us when we are in a good place, and to remember to ask ourselves when we're sad, when we're in pain, what do I need now? What might be helpful to me now? And do it. Studies have also shown a tremendous impact of self-compassion, which is really the ability to acknowledge, again, our strengths and our vulnerabilities, to be kind to ourselves, and to acknowledge our Achilles heels, so to speak. Our vulnerability is not the same as to say, oh, I excuse myself, or it's okay that I'm like this. And it's really more about changing our attitude to it, which can be very helpful, because while we may not change everything about ourselves that we would like to, if we recognize those things and we allow ourselves enough kindness that we don't feel too defensive about it, then we can actually tell ourselves that when we find ourselves acting this way yet again, it's okay, we'll do better next time. We can acknowledge it, we can own it, we can apologize for it, as opposed to blaming or justifying or trying to avoid within ourselves recognizing that we failed yet again. And sometimes people say, but isn't that like being too easy on yourself? Isn't that just like self-indulgent? And I say, no, self-compassion is actually a form of self-support, as Kristin Neff, who is an expert in this field, says. It actually increases our inner strength. It helps us pick up and try again and try harder, whereas beating on ourselves and saying what we did wrong and musing about what we feel guilty for and what we are to be blamed for actually takes away from our strength. So it's really important to allow ourselves to see self-compassion as a form of self-support that is necessary to enhance our capacity to do better. Another thing that is very important for me to mention, again, based on the lifelong longitudinal studies, the Harvard developmental study, adult developmental study, and others that looked at what makes people do better at the older years, some of the very important findings show how important relationships are. And the second generation, because of the issues that we delineated, sometimes have had complicated relationships also with their own spouses and their own adult children, especially women. I sometimes say that it seems like for many daughters of survivors, marriages were a certain compromise formation that was struck between, on one hand, marrying and having children because that's what would bring our parents nachas and that's what they wanted. But at the same time, studies suggest a possibility that many daughters of survivors entered from the beginning into ambivalent relationships, not, completely positive relationships with the person that they married, because on some level it was very difficult to allow oneself to be completely in love with someone from outside the family, someone who was not the parents, as if that would be a certain disloyalty towards the parents and what they have done for us. So this is a time to work on the couple relationship, because the couple relationship is so important for our well-being in the next phases of life. And therefore, it is very important for us to recognize that we all react from our past in the present in every step we take, that is really to be looked at as a form of emotional learning that took place in a certain context where it made sense, but it needs to be re-examined in order for it to become open for corrective input, and that we can reevaluate it now to see if it still makes sense. The way I responded to my spouse right now, does it still make sense in the current context? What I feel when that happens, the fact that I go immediately to, oh, he doesn't care about me, or it's always my fault, or whichever our thinking trap might be, does it actually make sense in this relationship? As I said before, learn to acknowledge and own and apologize promptly when we think we acted from our not best, areas, and learn active listening. Learn what active listening is. Don't expect the other to fix past hurts. They can only be a good partner in the present, and we need to work together using active listening to do that. We can't expect anybody to read our minds, and we can't expect anybody to correct, as I said, wounds that were inflicted a long time ago, but we can make each other aware of them, we can make ourselves aware of them, and together we can work to avoid those automatic patterns that we use when we feel that our wound has been activated by our spouse or an older child or somebody else. Identify our strengths and learn to utilize your own and your spouse's in a way that can create a good team. We don't have to be all the same. We don't have to be symmetrical. We don't have to have symmetrical strengths. We need to learn each other's strengths and how to use them in the best way. And finally, we know that sex is often another casualty of trauma. And it's very important for us at this point in life, as part of working on intimacy in the couple, to revitalize and make sure that we have that too as another element that strengthens our sense of intimacy, our sense of being still alive, of being fully alive. It's revitalizing both individually and in terms of the couple relationship. And the couple is, as we see from studies, a very powerful system for mobilizing and for sustaining well-being, psychological and physical, in the later part of life. Another element that helps cultivating resilience, as we see in the studies, is to find and identify with resilient models, someone that you already see as having navigated whatever adversity you're coping with right now successfully, that can provide good modeling, good support, and that is part of establishing, a supportive social network around ourselves. It's very important, especially in the later part of life. We really need to do that. Our friends help us maintain a more optimistic view, a more positive sense of who we are, and they also sometimes, if they're a good friend, encourage us to do what we know we need to do for ourselves but are not doing, and they provide incredibly valuable support. And finally, it's important to seek professional help if we think that something is lingering too long, if a problem is lingering. And part of resilience, as we said in the very beginning of the meeting today, is navigating towards resources. thank you very much. And there are many, many resources for you that are listed in the next slides, and we'll go quickly to the Q&A. Thank you.
Thank you so much, Irit. That was a lot of information, a lot to take in, and we appreciate the depth of your research and the vast breadth of the information shared. I have a couple of questions I'd like you to address. Maybe we'll work from the back toward the front, because it was I think a very interesting point and question that came up. So regarding aspects of self-care and resilience, can you provide some strategies for processing and dealing with pain that can be achieved through better social connections, rather than how one might address this through internal processes that perhaps prevent an individual from seeking greater social interactions? The example given by the writer was a tendency towards reading as a way to avoid processing and dealing with pain. Can you offer some strategies in that direction?
So the person said essentially that they are finding themselves retreating into away from social interactions, into reading.
Right.
Did I get you?
Yes. It was the way this person described self-soothing
Right.
through reading as an extension of avoidance and processing with the pain, and inquired specifically about strategies toward better social interactions and networking.
Well, I think that that's an incredibly good example of how the same thing can be an asset and a liability. Obviously, for this person, it was very helpful. It was something that they learned works for them throughout life. They could always retreat into a book, and that was self-soothing, and that was very helpful. But the same strength can become a liability if it kind of becomes too rigid and becomes the go-to automatic pattern at the cost of other things, or at too much of it can become a liability, because it will become essentially an extension of avoidance or of retreating from other people, right? There must have been a good reason for this coping to develop in this form for that individual, but there is no magic here. We need to understand what happened, why we developed it, why it was very valuable for us, still is a very valuable thing for us, but why perhaps it mushroomed a little bit too much into an almost, overemphasized strategy, and that we must also force ourselves to stretch a few other muscles and develop, despite our wish to automatically retreat into this one, which has always been available to us. We must push through and force ourselves into a few other things that have also occasionally been helpful for us. And when I say there's no magic, I go back to the statement that I made fairly early in the beginning. We have to be intentionally focused on making those changes, and we have to understand that it takes effort, and it takes time, and it takes intentional focus, and we have to be a little bit patient with ourselves, but we must make that decision, and that's why I went back to this slide. Resilience involves an active decision to do what we now know we need to do differently.
Thank you. We have 1 minute left, and I'm wondering if you could give a quick, I don't know if anything is quick, but when you spoke about training and resilience and the ABC method to learn to differentiate between the activating event, beliefs about it, and consequences of these thoughts. Can you give a concrete example that demonstrates itself within the 2G population and take us through this exercise in 1 minute?
Well, okay, I really I should have thunk of a good example before, but guilt, for example, is a very, very common response in the second generation. So something happens no matter what, and the go-to automatic pattern is guilt. We have to think so when you feel this coming up in you, something happens and you feel that flooding of guilt, to stop for a minute and think, what made me feel this way? And then really take a look at it, at the particular situation and the parameters, and think, is that still relevant, this kind of a response? Is that appropriate for this? What are other ways of looking at this situation? And then how could I respond differently to this particular event? What other feelings, what other emotions, what other thoughts can I have about it? And what therefore would be different behavioral reactions to it. Does that help in any way?
Yeah, that is helpful. That's very helpful. It's now 1:31, and out of respect to those people who have logged in, we need to end this, but there are several questions that we would otherwise be asking. So I want to thank everybody for signing in today. I want to thank you, Irit, and I want to remind everybody to please make sure that you are registered for sessions 5 and 6, December 17th and December 31st, and please share this information with friends and colleagues. Thank you so much. Chag Sameach, happy Hanukkah, and thank you for tuning in.